Malliotakis 7 minutes if she needs it, with equal time being granted to a member of the minority at the ranking member's discretion. Ms. Malliotakis, you're now recognized.
Thank you, Mr. Chairman. I want to thank the witnesses for being here today. My condolences to those who had lost loved ones wrongfully taken away from them. I'm going to highlight the timeline and the decisions that were made by the Cuomo Hochul administration in New York that ultimately led to over 15,000 of our seniors dying in nursing homes. On March 13th, 2020, the CDC and CMS released guidance stressing that a COVID-19 positive nursing home resident must be quarantined and properly treated. The guidance directly forbids nursing homes from accepting patients they were unable to properly treat. On March 23rd, the CDC released updated guidelines detailing when and how to transfer and discharge hospitalized patients. It encouraged testing, requirement of 2 negative tests or 72 hours after the resolution of symptoms. On March 24th, and I know those of us from New York remember this very vividly, the governor during his daily press conference said, "My mother is not expendable, your mother is not expendable, and we are not going to accept the premise that human life is disposable, and we're not going to put a dollar figure on human life." Despite those nice words, the very next day, on March 25th, the governor issued his lethal directive mandating nursing homes, regardless of ability to provide care, to accept COVID-19 positive patients discharged from hospitals. The directive prohibited the nursing homes from testing the patients prior to admittance, and the nursing homes were not even given the proper PPE to care for these individuals. This continued even after, in New York City, we had alternatives, U.S. Navy Comfort, Javits, South Beach Psychiatric Center in my district. This was directly against the CDC and the CMS guidance and common sense. It wasn't until May 10th that the governor quietly rescinded the March 25th directive. And by the time this dangerous policy was rescinded, almost 50 days later, over 10,000 nursing home deaths occurred, including some in 323 facilities that apparently had reported no COVID-19 infections before receiving admission or readmission of hospital residents who had been diagnosed with COVID-19. As I mentioned, there were alternatives that Cuomo had even asked for. He ordered some of them to be set up, and then he didn't use them. On April 7th, Mike Dumont, the Vice Admiral of the U.S. Navy, emailed Melissa DeRosa, Governor Cuomo's top aide, the email here, pleading for help to get more patients into the Javits and the U.S. Navy ship Comfort, as they only had 83 and 37 patients respectively. DeRosa then sends an email to the executive chamber staff, which to us seems like she was just trying to cover herself. And then in a recent interview, Cuomo said that by the time the U.S. Navy Comfort ship arrived in early April, they no longer needed the beds, which is completely false. In fact, over 7,000 COVID-positive patients were transferred from, to nursing homes from the time the ship arrived to when the governor's directive was rescinded on May 10th. 7,000. After his March 25th directive started receiving more and more attention during his daily briefings, Cuomo and an array of high-ranking government officials, including his top aides DeRosa and the health commissioner, Howard Zucker, who, by the way, shockingly, I think to everyone in this room, now serves, he's been elevated to serve as President Biden's Deputy Director of Global Health at the CDC. Well, they began to participate in a cover-up. Their efforts would result in the true number of nursing home fatalities being suppressed for months. And I've got another chart which will show you the difference. It wasn't until the Attorney General accused Cuomo and his cohorts of underreporting and the Empire Center, which we thank Mr. Hammond for being here today, winning a court order releasing the complete data. So my first question, Mr. Hammond, your organization did a tremendous public service fighting to obtain this information and complete the complete data. How was the information manipulated based on your assessment?
So starting in April, the state was releasing counts, not just of how many people had died generally, but also a separate number for nursing homes. And then a few weeks later, they modified how they were releasing that to take out the cohort of residents who had died after transfer to a hospital. So when they got sick enough that they needed hospital care. They were probably put in an ambulance, taken to a hospital, and then they died in the hospital. And the state stopped including those people. It had data on how many of those people there were, but it backed them out of its daily reports.
And why would they do this, in your opinion?
I believe they were trying to make the situation in nursing homes look less bad than it was because it was embarrassing to them.
And because they did not comply with the CDC guidance and CMS guidance.
Yeah, that was, they were probably aware because of the order that had been issued that they were going to be blamed for how bad things got.
Now, New York State's Department of Health released its report with the manipulated data on the fatalities the same day that Governor Cuomo was meeting about his book deal. Do you find that to be a coincidence? Or do you think that there were personal reasons, business reasons, ego to the decision?
I mean, I can't get inside anyone's head. It is a remarkable coincidence that that report you're referring to came out in early July. It was ostensibly a kind of quasi-scientific analysis of the situation in nursing homes. It had been rewritten by the governor's office, and they had pulled out relevant data, and they'd modified its findings. Okay.
Thank you. 15 seconds, two important questions. In 2021, the governor, Hochul, right, the successor and lieutenant governor to Cuomo, promised that she would be transparent to launch a review of what happened in the nursing homes. Did she fulfill that promise? Yes or no?
Not yet.
Okay, and my last question, was there a difference in reimbursement rates between nursing homes, hospitals, and the U.S. Navy Comfort ship?
I don't know the answer to that.
Okay. Well, we would like to get the answer to that question, Mr. Chairman. I think that's a very important question. I want to thank Mr. Chairman for the time, and I ask for unanimous consent to submit an op-ed written by Mr. Peter Arbini, who's here today, in the Daily News titled, "Still Looking for Answers on COVID," as well as testimony from families in my district who lost loved ones in New York's nursing homes.
Without objection.
Thank you.
I now recognize